Hi, so my name is Garric. Vosloo. This is Functional Medicine Fast Track, and I'm coming to you today to chat to you a little bit about what I hear so often. And it's just a little bit crazy because what tends to happen in functional medicine is there's this big association to nutrition. And nutrition, by all means, is very important, but we've got to be aware that nutrition is not functional medicine. And that is key because sometimes that is a major block towards moving to enter into the world of functional medicine. And for patients, they think that they've done everything as far as nutrition goes to help them with their situation, their signs and their symptoms, and they're still stuck. So they kind of lose hope. So we just hear this so often, and nowadays we tend to get a lot of patients that seem to have their nutrition on point, and they've cleaned it all up. They're dairy free, they're gluten free, they're sugar free, they've done all the elimination diets, they've tried a ketogenic diet, they have done the Mediterranean diet, FODMAP diet, potato diet. There's everything out there, and then they're still kind of stuck, and it's really, really crazy. And so I want to chat a bit about this and just show you how the body is just so connected that when we lose this concept of one area equals everything, then we can open up our minds to realize that the body is a whole, and we have in our scope of practice so many different things to explore to help a patient. So for my example, looking at chronic neuromuscular skeletal situations, so often we see somebody that is plateaued, that's got something really chronic in that area, that has gut issues plus other things, and we need to be looking at those factors to be able to help their chronic neuromuscular skeletal conditions. Otherwise, they're just going to be stuck and continue in that process. So the first thing that we see is that there's a lot of guessing out there. When I say guessing, is there's no objective data to be able to actually say to a patient, this is exactly what you need. And in functional medicine is personalized, individualized treatment. We see so many patients with knee arthritis, and when we go back to track them into their signs and symptoms and the root cause, they all have very different signs and symptoms, or root causes, I should say. From one sign and symptom, many different root causes. And you can put that into the reverse situation as well, where one root cause can display as many different signs and symptoms. So that is key. So the key is, first of all, not to guess. We need to understand the metabolic pathways, and I want to get into that a little bit just now. But the first thing is to realize that we actually need to be able to measure and have some objective measurements to guide a program into a personalized way that we get results quickly. Patients have usually been from pillar to post. They're tired, they're hearing the same story, they don't want to hear the same story, they want something different, and the only way to be different is to actually do it properly and get the objective data. So a lot of the time, patients have just not been tested properly. They have not had a proper gut analysis and finding out from an advanced perspective where they stand as far as their gut goes. And there's a way to go through that, and that's not the point of this talk, to find out exactly what the numbers are. Is there inflammation? Is there dysbiosis? What is going on? What do we need to actually fix? So that's step number one, and it's not the point of this talk. The point of this talk is to show you and to just open up your mind to understand that there's many other factors that influence whatever we pick up on those objective measurements. So the key is to realize that stress in itself lifts cortisol up, and cortisol has a massive impact on the gut lining. That's an example. Another example is just a sedentary life produces oxidative stress. That oxidative stress has been linked to leaky gut, inflammation, and so on. So being active in itself has a massive positive role. When we come to marriage and issues in a marriage and that low chronic stress level of whatever vibrational level that may be, that is going to cause issues again. So we've got to start connecting the dots to all of these factors. We've got to look at sleep. Is somebody sleeping deeply and enough to be able to get the right curves in all their hormonal levels. And again, it's about balancing all those hormones which are supporting the gut, and the gut is supporting the hormones to help any chronic neuromuscular skeletal condition and any other signs and symptoms and diagnoses that the patient may present with. So that is fundamental to know, that nutrition is part of it, but it's not the be-all and end-all. Otherwise, all nutritionists, dietitians would have solved all the world's health problems, and we wouldn't need this concept of functional medicine to be able to understand all the different systems in the body, how they connect together, how they work, and how do we move forward to help a patient with a personalized program. So the key is, the next point is, each person is very, very individual, and we have to personalize a program. I always say that before functional medicine, and I understood all the different metabolic pathways and how it all kind of connects, I needed to be a genius to figure out exactly how to help that patient, because I didn't have the numbers, I didn't have the data in front of me. Nowadays, I feel like it's just a breath of fresh air, because we know what data to gather, what tests to do, how to look at the underlying root causes. And once we've got all that data, it points us in the right direction of knowing the imbalances and how to solve them. So it just takes the guessing game out of everything that, as a clinician, before having all this understanding from a functional medicine concept, that we were getting stuck with those percentage of patients that would just never get better, would never resolve. And now we're able to move those patients to the next step, because we have that understanding, we can measure, and then we can put a program together that is very concentrated, very individualized for that patient. That is the key. So let's just talk about a little bit deeper into, particularly with a gut issue, why that's so fundamental to understand. And so often when we look at different imbalances in a person's body, we know that hormones control the majority of how we feel, how we're reacting, how we're responding, but it's not where we go to first to try and change. We look at the underlying root causes that are disrupting those hormonal levels. And so often with a patient coming to us who seems to be on point with their nutrition, gluten-free, dairy-free, sugar-free, so and so on, and they still have recurrent problems, we need to go and have a look at why that is happening. And the one key area to understand is how inflammation actually disrupts the whole system. And the one way that it does do that is when we have inflammation, oxidative stress, and dysbiosis in the gut, is it doesn't allow particularly two nutrients, tryptophan and tyrosine, to move towards dopamine and serotonin, which are good feeling hormones. And what we so often just listen for when we're working with patients through programs is, how do they feel? And what we often find within a few weeks of putting them in the right direction is their comments come back that I'm feeling calmer, feeling more relaxed, I've got more clarity, and I'm just starting to sleep better. So those few words are telling me, there's an improvement in dopamine, improvement in serotonin, and what comes along with that is reduction in pain, because now we know inflammation is being settled because those pathways are actually being corrected. They're not moving towards what we call pathways to producing organic acids called quinolinate, picolinate, and kynurenate, but rather producing the good hormones that help us to feel calmer, feel more in tune with who we are, relaxed, you can make decisions, and you don't have that heightened response of adrenaline, which cortisol works alongside with. So when we start to understand, and I'm bringing a lot of complexities into this, just to show you how that all connects. And we hear this so often, and just by hearing a patient saying, I'm feeling calmer, I'm in the right direction, we know that their neuromuscular skeletal conditions are going to start settling as well, because their whole system is in the right direction. So that's just the connection of how we see gut. It's not purely about nutrition. We've got to look at the whole aspect, and then how inflammation and imbalances and dysbiosis do create changes in how a person feels, and how you can start to listen to those feelings to know that they're in the right direction and move forward from there. So I hope that's been helpful as just kind of a tip in getting your head around it. And I want you to understand that functional medicine is not just all pure nutrition. There's many other aspects that for things like the gut, let alone the neuromuscular skeletal situations, we can help because we can give general advice as far as sleep goes, as far as relationships goes, as far as what exercise to do, and look at all those other lifestyle factors that contribute to the gut being healthier and more stable and less inflammation. So alongside good testing and knowing what to bring in when you get those results is key. So if this makes sense and you want to learn some more about it, go straight to our website, www.fm-ft.com, which stands for Functional Medicine Fast Track.com, and you will get a lot more information there on our blog. So my name is Garric Vosloo. This is Functional Medicine Fast Track. It's been great spending time with you, and I hope that's inspired you into the world of functional medicine. Until then, take care. Bye.